Today, if you were to look across the board at people who address cosmetic and aesthetic and skin aging issues, there is a consensus. The best way forward is what is called GRAS, the mnemonic. GRAS stands for G for growth factors, R for retinoids, which are vitamin A compounds, A for ascorbic acid, which is vitamin C, S for sunscreen, and the S for specific lesions. That is, as we grow old, we tend to develop some growths for skin cancer, removing those. Removing the growths and giving enough vitamin C, using vitamin A compounds. The thing is, all those things which I have mentioned, RASs, have been around for a very long time, several decades. But the use of growth factors, installing the aging of the skin or reversing the aging process of the skin, is a relatively new concept. It's probably not more than a decade old. And till recently, it was largely experimental in that all the scientific literature was only from the laboratory, but now we have clinical studies, meaning to say the use of the product on human skin, clearly documenting the improvement in things such as laxity of the skin, the fine lines and wrinkles, the dyspigmentation, the dullness of the skin, the loss of radiance, the loss of thickness. All these can be reversed. In other words, we are not talking about applying a cream and turning into a film star, but we are talking about products which do have a very sound basis for stopping and to an extent reversing the aging process. So if you are feeling young and strong and fit and healthy, there is no reason for you to have a hangdog look on your face. You can use products to keep your facial or body skin in tune with how strong you actually are or feel. There are people in their 60s and 70s who run marathons. There are people in their 90s who do long distance cycle rides. Why should they look old and haggard? So we have products which may not make them look 25 when in their 60s or 70s, but we can certainly make them, their looks match with what the rest of the body is capable of. The thing is, the whole purpose of this exercise is to educate the press who have access to the public to know that these technologies exist, to know the names of the products, to know how they are made, so that when products appear on the market and where there is a discussion or a debate, they are in a knowledgeable position to instruct the public. The doctors love to do that, but our access is limited. We just talk to our patients in our chamber, and as even medical associations, our reach is limited. But the press, your reach is tremendous, which is the reason why we spend time with you, so that you may know and thereby educate correctly. We need to know that if a product contains growth factors, if the growth factors are labeled in it, that will be a good product. And if you can speak to the company who manufactures a product and ask them what are the factors present in it, and they can prove the data on file, they can provide it to you, that's a good starting point. Labeling is by far the best thing. In certain countries, even cosmetic products require full labeling. Belgium was the first country to bring this into rule, and there are many European countries who do that. We don't have adequate labeling laws in this country. We should look into that for consumer products. So once the consumer is knowledgeable as to what he wants from a given product, and also knows that this is what is likely to be beneficial, he can just read the label and decide for himself how much of what is there in this, and is it there, firstly, is it there in the right quantity. If he can determine this much, he can buy a lot more intelligently and get the results he or she wants. That's the point. Like the mnemonic GRAS. So you can look for retinols, retinoids, ascorbic acid, or vitamin C, and sunscreens. There are good sunscreens available across the counter which don't require a doctor's prescription, which from good companies, both Indian and multinational. We just need to know about those things.